Hi, I'm John Hovanesian. Let's talk about cataract. Cataract is one of the commonest problems that happens as we have more birthdays throughout life. It's a condition where the internal lens of the eye gradually becomes more cloudy. Its earliest symptoms really aren't noticeable, but what happens for many people is that they start to have more difficulty doing visual tasks that are hard to do already, like reading fine print or seeing in a dim environment small print. Driving after dark, headlights become a cause of glare and difficulty seeing well. And anything that involves seeing well under harsh conditions just becomes more difficult. Cataract never gets better on its own, and eventually, when the problems become significant enough, we end up doing surgery. Cataract surgery involves removing and replacing the internal lens of the eye with an artificial lens implant. It goes in the very same place in the eye. It never gets old. It never needs maintenance or replacement. About the only thing in the future that may be needed is about 50% of people within 10 years will develop a cloudy membrane behind the lens implant in a membrane that they were born with. The treatment for that involves a laser, which takes just a few minutes, is painless, is covered by insurance, and only happens once. So it's a simple problem to solve, much easier than cataract surgery if it happens at all. Cataract surgery is a procedure that takes 10 or 15 minutes. We usually do one eye and then the other eye on a different date. The surgery is done in a facility where we give our patient an IV and very mild sedation so that they're very comfortable. Many of our patients have previously been through a colonoscopy. That's a procedure where sedation is given to make unpleasant things easy to go through. And cataract surgery is a similar type of sedation. Most people can experience a little bit of grogginess the same day as surgery, a little bit of scratchiness in the eye, but most people don't have significant pain. And the next day, most people can go back to most normal activity, like driving and reading and showering and using a computer. There's not a lot of downtime with cataract surgery, but there always are some risks. With any surgery we perform, we think about two different categories of risk. The first are severe complications, things that if we couldn't control them could lead to blindness. These are, in general, around 1 in 1,000 chances. Retinal detachment, major infection, major bleeding inside the eye could lead to problems that we could not fix. The other category are things that are more common but much less serious. So delayed healing, needing additional surgery, a scratchy feeling in the eye, blurriness, a droopy eyelid, double vision. I can't possibly list all the different things that can happen, but each of these is perhaps a 1 in 100 risk that can happen to anybody. And sometimes we can fix the problem, sometimes we can't fix the problem. You have individual risks that relate to your eyes and your own health condition, and we and our staff will talk with you about those when you're getting ready for surgery. As always, you can always ask questions about any of the risks of surgery to us or our staff.